Parotid gland. Parotid gland is the largest. Okay, parotid gland. Parotid gland, it is the largest of the three paired salivary glands. It weighs about 25 grams in weight. And coming to the parotid gland, first we have to discuss about So, first we need to discuss about coverings of the parotid gland. So, the parotid gland, it is covered by two capsules. One is true capsule and the next one is false capsule. Coming to the true capsule, it is formed by the condensation of the fibrous stroma of the gland. And coming to the false capsule, it is derived from the investing layer of deep cervical fascia. And the investing layer of deep cervical fascia, it divides into superficial lamella and deep lamella. So the superficial lamella, it is very thick and it forms the parotid sheath. And it is called parotid sheath, and it is attached to the lower border of zygomatic arch. It is very thick, and from the zygomatic arch it covers the masseter and forms the parotidomasseteric fascia. And coming to the deep lamella, it is very thin and it is attached to the styloid process. From there, styloid process, it is thickened to form the stylomandibular ligament, which is attached from the tip of the styloid process to the angle of the mandible. So only two capsules are there. One is true capsule and the next one is false capsule. True capsule, it is formed by the condensation of the fibrous stroma of the gland. And coming to the false capsule, it is derived from the investing layer of deep cervical fascia, and the superficial lamella of the false capsule, it is very thick and it forms the parotid sheath and it is attached to the zygomatic arch. From there it covers the masseter to form the parotidomasseteric fascia, and the deep lamella, it is very thin and it attached to the styloid process. From there, the deep lamella, it is thickened to form the stylomandibular ligament, which is attached to the angle of the mandible. And coming to the presenting parts, the parotid gland, it is an inverted pyramid shape. The parotid gland, it is an inverted pyramid shape. The apex is facing downwards and the base is upwards. And it has three surfaces. These are superficial surface, anteromedial surface and posteromedial surface. So, and also three borders: anterior border, medial border, and here is anterior border, posterior border, and here is the medial border. So medial border, it's on the back side. We can't see the medial border from the front view. So the parotid gland, it is an inverted pyramid. It is having base and apex facing downwards and base is upwards, and it is having three surfaces: superficial surface, anteromedial surface and posteromedial surface, and three borders: anterior border, posterior border, medial border. Okay, coming to the apex, it is facing downwards and it enters into the carotid triangle. And from the apex, three structures emerge from the apex. They are cervical branch of facial nerve and anterior division of retromandibular vein and formation of external jugular vein. We know that how the retromandibular vein forms. The retromandibular vein is formed by the union of superficial temporal vein and maxillary vein. The retromandibular vein, it is formed by the union of superficial temporal vein and maxillary vein, and this retromandibular vein again divides into anterior division and posterior division. And coming to the anterior division, this anterior division, it emerges from the apex of the parotid gland. And coming to the posterior division, this posterior division, it combines with this posterior division of the retromandibular vein. This posterior division of the retromandibular vein, it combines with the posterior auricular vein. Here we can see the posterior division of the retromandibular vein combines with the posterior auricular vein to form the external jugular vein. So from the apex, three structures emerge: cervical branch of facial nerve which supplies the platysma. We know that platysma is a subcutaneous muscle and it's a muscle of facial expression. Because platysma, it is derived from the second branchial arch. It is the nerve of second arch is facial nerve. So the platysma, it is supplied by the cervical branch of facial nerve. And coming to the other structure, anterior division of retromandibular vein. The anterior division of retromandibular vein, usually the retromandibular vein, it is formed by the union of superficial temporal and maxillary vein. Superficial temporal and maxillary vein together form the retromandibular vein. And the retromandibular vein again divides into anterior division and posterior division. The anterior division of retromandibular vein emerges from the apex of the parotid gland, and the posterior division, it unites with the posterior auricular vein. And the posterior division of the retromandibular vein, it joins with the posterior auricular vein to form the external jugular vein. So this is about the apex, and this apex, it overlaps the posterior belly of digastric. This apex of the parotid gland, it overlaps the posterior belly of digastric. The origin of the posterior belly of digastric, it is from the mastoid process. So the apex overlaps the posterior belly of digastric, and three structures emerges from the apex, that is cervical branch of facial nerve, anterior division of retromandibular vein, and also formation of external jugular vein, which is formed by the union of posterior division of retromandibular vein and posterior auricular vein. That's about the apex. And coming to the base, this is the base. So the base, it is concave in shape. It is shaped according to the external acoustic meatus. See the base. Okay. And coming to the base, it is related to the posterior part of temporomandibular joint. The base, it is related to the, see here, this is the base, and it is related to the external acoustic meatus and also capsule of the temporomandibular joint. Here is the temporomandibular joint is here, and this is the zygomatic arch, and this is the digomatic arch, and this is the temporomandibular joint, and here is the capsule of the temporomandibular joint. So the base is upwards and it is concave, and it is related to the external acoustic meatus. Here is the external acoustic meatus and also the capsule of the temporomandibular joint. Coming to the structures which are emerging from the base. So this is the base, right? So the structures emerging from the base are temporal branch of facial nerve and superficial temporal vessels. Here vein is also there. Superficial temporal vessels and auriculotemporal nerve. So first is the temporal branch of facial nerve. So first is the temporal branch of facial nerve, and then superficial temporal vessels and also the auriculotemporal nerve. So temporal branch of facial nerve, you know that temporal branch of facial nerve, it supplies the muscles here, the frontalis muscle and also the orbicularis muscle, and the corrugator supercilii, it supplies the muscles of facial expression. So temporal branch of facial nerve, and the superficial temporal vessels, the superficial temporal artery is a branch, the terminal branch of external carotid artery. So the superficial temporal artery, it also emerges from the base, and the auriculotemporal nerve, it is a branch from the posterior division of the mandibular nerve. So this about the base. And coming to the surfaces of the parotid gland. So the parotid gland, it is having three surfaces. This is what we are seeing is the superficial surface or lateral surface, and behind we have posteromedial surface and anteromedial surface and posteromedial surface. So coming to the superficial surface of the parotid gland. Superficial surface of the parotid gland, it is covered by skin, superficial fascia and also superficial lamella of the investing layer of deep cervical fascia. We already told that the parotid gland, it is covered by true capsule and false capsule. So the false capsule, it is derived from the investing layer of deep cervical fascia. So the superficial surface or lateral surface of the parotid gland, it is covered by first skin and then superficial fascia and then superficial lamella of nothing but parotid sheath. Superficial lamella of the investing layer of deep cervical fascia, that is nothing but the parotid sheath. And on the superficial surface, on the superficial fascia, we will see subsuperficial group of parotid lymph nodes. So that's about the superficial surface. And coming to the anteromedial surface. So the anteromedial surface, this is the anteromedial surface from the back side, not from the front side. This is the anteromedial surface. The anteromedial surface here is the anteromedial surface because this is the medial border, and this medial border divides the parotid gland into anteromedial and posteromedial. So this is the medial border on the back side. So coming to the anteromedial surface is here, and it is related to, this is the masseter muscle. So masseter muscle, it is one of the important muscle of mastication, and it is arised from the zygomatic arch, and it is inserted to the ramus of the mandible. So this is the ramus of the mandible, we can see. So here, this is the ramus of the mandible. So the masseter muscle is inserted here. Here is the section of mandible. So the anteromedial surface, it is related to the inferior part of the ramus of the mandible, inferior part of the masseter muscle, inferior part of the masseter, and also posterior part of temporomandibular joint, and also it is related to the medial pterygoid muscle. Near its insertion. So the anteromedial surface, it is related to postero-inferior part of the masseter. Masseter arises from the zygomatic arch, and it is inserted to the ramus of the mandible, and medial pterygoid muscle, it is inserted near the angle of the mandible. So this is the angle of the mandible. So this is the angle of the mandible, and the medial pterygoid muscle is near its insertion, and also temporomandibular joint. And coming to the posteromedial surface. So anteromedial surface, it is nothing but is related to masseter, medial pterygoid muscle, and temporomandibular joint. And coming to the posteromedial surface, this posteromedial surface, it is vast, and it is related to this stenomastoid muscle. We know that the sternocleidomastoid, it has two heads, sternal head and clavicular head, and this is sternal head arises from the mastoid process. The mastoid head arises from the mastoid process, and this is the sternocleidomastoid, and it is also related to styloid process. So the posteromedial surface, it is related to stenomastoid muscle and styloid process, and between the mastoid process and styloid process, we have a foramen is there, stenomastoid foramen is there, and here the facial nerve emerges from the stenomastoid foramen. The facial nerve emerges from the stenomastoid foramen. So, and this is a styloid process. So the styloid process, we know that it is a part of temporal bone. So from the styloid process, three muscles arise, that is styloglossus, stylopharyngeus, and stylohyoid. So the posteromedial surface, it is related to stenomastoid process and stenomastoid muscle and styloid process, stylomastoid foramen where facial nerve emerges, and also styloid group of muscles. And the facial nerve, it enters into the gland. The facial nerve, it enters into the gland by emerging through the posteromedial surface. So that's about the posteromedial surface. Again, I am repeating the posteromedial surface. The posteromedial surface, it is related to the mastoid process, stenomastoid muscle and stenomastoid foramen where facial nerve emerges, and the styloid process. And from the styloid process, three muscles arise: the styloglossus, stylopharyngeus, and stylohyoid muscle. And stylomandibular ligament is also there, which is attached from the tip of the styloid process to this is the angle of the mandible, right? So this is the angle of the mandible, which is arised from the tip of the styloid process to the angle of the mandible, and the facial nerve, it enters into the gland by piercing the posteromedial surface. So that's about the posteromedial surface. So the three surfaces are over, and coming to the borders of the gland, the anterior border, posterior border, and medial border. The medial border separates the anteromedial surface from the posteromedial surface. Coming to the anterior border of the gland, from the anterior border of the gland, some structures are emerging from the anterior border of the glands. From upside down, these are the structures emerging from the anterior border of the gland. First is zygomatic branch of facial nerve, and then transverse facial artery, which is nothing but a branch of superficial temporal artery, which is nothing but a branch of superficial temporal artery, and upper buccal, which is a branch of facial nerve, and lower buccal, which is also a branch of facial nerve, and marginal mandibular, which is also a branch of facial nerve. And between the upper buccal and lower buccal, we have parotid duct is there. So these are the structures emerging from the anterior border of parotid gland. So we know that facial nerve, it gives 5 branches, that is temporal nerve, which is emerging from the base, and the zygomatic branch of facial nerve, which is emerging from the anterior border, upper buccal, lower buccal, and marginal mandibular. Of course, cervical branch is also there. And from the anterior border, zygomatic branch of facial nerve, transverse facial artery, and between the upper buccal and lower buccal nerves, we have parotid duct intervening and the marginal mandibular. These nerves, the zygomatic branch of facial nerve, upper buccal, lower buccal, and cervical branch of facial nerve, marginal mandibular branch of facial nerve, these all supplies the muscles of the face. Okay, and that's about the anterior border. So these are the structures emerging from the anterior border. And coming to the posterior border, it is related to posterior auricular branch of external carotid artery and posterior auricular nerve. Here one point is there. After emerging from the stylomastoid foramen, the facial nerve, it gives one branch, that is posterior auricular branch, and after giving posterior auricular branch, it enters into the posteromedial surface of the parotid gland. So here is the posterior auricular branch of facial nerve and also posterior auricular branch of external carotid artery. These are the structures emerging from the posterior border. And the medial border, it is of no significance, just it separates the anteromedial surface from the posteromedial surface. So that's about the borders of the parotid gland. And coming to the structures passing through the parotid gland. So 3 structures will pass from the parotid gland, from superficial to deep, 3 structures. First one is facial nerve, and the next one is retromandibular vein, and the third one is external carotid arteries. From superficial to base, nerve, vein, artery, NVA structures. From superficial to deep, 3 structures passing through the gland. NVA, nerve is facial nerve, and vein is retromandibular vein, and artery is external carotid artery. Coming to the facial nerve, I have already explained you, the facial nerve emerges from the stylomastoid foramen. And after coming from the stylomastoid foramen, the facial nerve gives one branch, that is posterior auricular nerve. And after giving posterior auricular nerve, the facial nerve enters the gland by piercing the posteromedial. This is the posteromedial surface. See, here is the posteromedial surface and this is the anteromedial surface. So the facial nerve, after emerging from the stenomastoid foramen, it enters the gland by piercing the posteromedial surface of the gland. And after entering to the gland, the facial nerve, it gives 5 branches, that is temporal. You can see in the diagram, temporal, zygomatic, upper buccal, lower buccal, marginal mandibular, and cervical. So that's about the facial nerve. And coming to the vein, that is retromandibular vein, and the superficial facial nerve is over, next one is retromandibular vein, and I have already explained that. So I'm coming to the retromandibular vein, which is deep to facial nerve. And coming to the retromandibular vein, it is formed by the union of superficial temporal vein and maxillary vein, and this retromandibular vein divides into anterior division and posterior division. We know that anterior division of retromandibular vein emerges from the apex of the parotid gland. So this is the apex of the parotid gland and this is the base of the parotid gland. So the anterior division of retromandibular vein, it combines with the facial vein and forms the common facial vein, and this further drains into internal jugular vein. So the retromandibular vein, it is formed by the union of superficial temporal vein and maxillary vein, and this retromandibular vein divides into posterior division and anterior division, and the anterior division of the retromandibular vein combines with the facial vein to form the common facial vein, and further it drains into internal jugular vein. And coming to the posterior division of the retromandibular vein, this posterior division of retromandibular vein, it joins with the posterior auricular vein, and it forms the external, and it drains into external, forms the external jugular vein, which further drains into subclavian vein. So that's about the retromandibular vein. So first is facial nerve, and after that facial nerve, NVA. So N is over, that is facial nerve is over, and coming, this is the retromandibular vein, and next is final is the artery, and the artery is external carotid artery. So the external carotid artery, it enters the gland. The external carotid artery, it enters the gland, and it divides into superficial temporal artery and maxillary artery. So superficial temporal artery and maxillary artery, these are the superficial temporal artery and maxillary artery. These are the two terminal branches of the external carotid artery. So, and from the superficial temporal, one artery arises, that is transverse facial artery, which emerges from the anterior border of the parotid gland. So that's about the structures piercing the parotid gland. First is facial nerve. Facial nerve, it gives 5 branches, that is temporal, zygomatic, upper buccal, lower buccal, marginal, mandibular. That means buccal branch divides into upper buccal, lower buccal, and marginal, mandibular, and cervical branch. And next is a vein. Vein is formed by the retromandibular vein. It is formed by the union of superficial temporal and maxillary vein, and it gets divided into anterior and posterior divisions. And the artery is the external carotid artery. External carotid artery, it enters the gland, and it divides into 2 terminal branches. That is superficial temporal and maxillary. From the superficial temporal, one small branch arises which supplies the face, that is nothing but the transverse facial artery. So that's about the structures passing through the gland. And coming to the parotid duct. Parotid duct, it is also called Stenson's duct, and it emerges from the anterior border of parotid gland, between the upper buccal and lower buccal nerves. It emerges from the anterior border of parotid gland, between the upper buccal and lower buccal nerves. And the parotid duct, after entering into the anterior border of masseter, so we can see the masseter muscle by clenching our teeth. See, this is the masseter muscle. So the parotid duct, after reaching the anterior border of masseter, it pierces the buccopharyngeal fascia, which covers the buccinator muscle, and also it pierces the buccinator muscle also. So the parotid duct at the anterior border of masseter, it pierces the buccopharyngeal fascia and buccinator muscle, and opens into the crown of the upper second, opposite the crown of the upper second molar tooth. So that is the opening of the parotid duct. So the parotid duct, it opens into opposite the crown of the upper second molar tooth. That's very, very important. The opening of the parotid duct is very, very important. That is the opposite the crown of the upper second molar tooth. So, and the parotid duct, it pierces the buccopharyngeal fascia and also buccinator muscle. So it is also called Stenson's duct. It is about 5 centimeters long and 3 millimeters width, the parotid duct. So that's about the parotid duct. And coming to the blood supply of parotid gland branch, that means the blood supply of the parotid gland. Here is the external carotid artery is there, the structures piercing the external carotid, structures basing the parotid gland. We know about the external carotid artery. So the branches of the external carotid artery, they supply the gland. And coming to the veins, so the retromandibular vein is here. So the tributaries from the parotid gland, they join the external jugular vein here. So the arterial supply by the external carotid artery, and the venous drainage to the external jugular vein. And coming to the nerve supply of the gland. Okay. Coming to the nerve supply of the gland, the secretomotor innervation of the gland is by both sympathetic and parasympathetic nerves. The preganglionic parasympathetic fibers, they arise from the inferior salivatory nucleus of the medulla, and then the preganglionic parasympathetic fibers, they reach the tympanic, the tympanic branch of glossopharyngeal nerve, and further the preganglionic parasympathetic fibers, they relay in the otic ganglion, and from the otic ganglion they reach the tympanic plexus, the postganglionic parasympathetic fibers, they reach the tympanic plexus and through the then lesser petrosal nerve, and it supplies the gland through auriculotemporal nerve. So that's about the parasympathetic innervation. The stimulation of the parasympathetic fibers, they cause watery rich secretions. Okay, and the parasympathetic innervation the preganglionic parasympathetic fibers, they are erased from the inferior salivatory nucleus of the medulla, and then they reach along with the tympanic branch of facial nerve, and they relay in the otic ganglion. And the relay in the otic ganglion, from the otic ganglion they form tympanic plexus, and through lesser petrosal nerve they reach the gland. It is supplied to the gland by the auriculotemporal nerve. So that's about the parasympathetic innervation of the gland. So the stimulation of the parasympathetic fibers, they cause watery rich secretions. Coming to the sympathetic innervation, we know that all the preganglionic sympathetic fibers, they relay in superior cervical ganglion or middle cervical ganglion or inferior cervical ganglion. So the preganglionic sympathetic fibers, they always relay in the superior cervical ganglion, and the postganglionic sympathetic fibers, they form plexuses around the nearby arteries. Usually the postganglionic sympathetic fibers, they form plexuses around the nearby artery. In the parotid gland, we have external carotid artery is there. So the postganglionic parasympathetic fibers, they form plexuses around the external carotid artery, and through the plexuses they supply the gland. And the stimulation of the sympathetic fibers, it causes mucus rich sticky secretions, and the parasympathetic stimulation causes the watery rich secretion, and the sympathetic fibers stimulation causes the mucus rich and sticky secretion, and the sympathetic fibers, they are also vasomotor. So that's about the innervation of the parotid gland, sympathetic and parasympathetic. Sympathetic by the inferior salivatory nucleus, preganglionic fibers, and then tympanic branch of glossopharyngeal nerve, and the relay in the otic ganglion. From that, tympanic plexus, lesser petrosal nerve, and they reach the gland through the postganglionic parasympathetic fibers. They reach the gland through auriculotemporal nerve. And coming to the sympathetic, they usually the preganglionic fibers, they relay in the SCG, and the postganglionic fibers, they reach by forming plexuses around the external carotid artery, and the CSCS stimulation causes watery secretion. This stimulation parasympathetic, and this stimulation causes mucus rich secretions. And coming to the lymphatic drainage. The lymphatic drainage, the lymphatic drainage is from superficial parotid lymph nodes, and next is superficial cervical lymph nodes are there, superficial parotid lymph nodes are there. So the lymph, it is drained into superficial parotid lymph nodes, and also some superficial cervical lymph nodes. So that's about the lymphatic drainage, and that's about the parotid gland.